Have you ever seen your blood pressure numbers jump unexpectedly high and wondered, is this serious? What should I do? It is a common concern, and knowing the right response can make all the difference for your health. The fundamental difference between a hypertensive urgency and a hypertensive emergency lies in one critical factor: the presence of acute or new target organ damage. In a hypertensive urgency, your blood pressure is severely elevated, typically above 180/120, but you are not experiencing any signs of immediate organ damage. On the other hand, a hypertensive emergency involves similarly high blood pressure readings, but it is accompanied by acute damage to vital organs, requiring immediate medical intervention. This distinction is crucial because the body's response to extremely high blood pressure can vary significantly. When your blood pressure spikes very high, it puts immense strain on your blood vessels and organs. In an urgency, while the pressure is dangerously high, your body is managing to cope for the moment without immediate organ distress. In an emergency, however, the elevated pressure is actively harming organs like your brain, heart, kidneys, or eyes, which manifests as new or worsening symptoms related to those organs. So, how do you respond? If your blood pressure is very high but you are not experiencing any symptoms like severe headache, chest pain, shortness of breath, vision changes, or numbness, it is likely a hypertensive urgency. In this situation, you should monitor your blood pressure closely, avoid panic, and contact your doctor or healthcare provider within a few hours to discuss next steps and adjust medications if needed. They may advise you on gentle ways to lower your pressure or to come in for an urgent checkup. However, if those high blood pressure numbers are accompanied by new or sudden symptoms such as a severe headache, blurred vision, sudden weakness or numbness on one side of your body, difficulty speaking, chest pain, shortness of breath, or back pain, then you are likely experiencing a hypertensive emergency. In this case, you need to seek immediate medical attention by calling emergency services, like 911, right away. These symptoms signal that your vital organs are under attack, and prompt treatment is essential to prevent permanent damage or life-threatening complications. Understanding the concept of target organ damage is key. This refers to damage to organs that are particularly vulnerable to high blood pressure, including the brain, heart, kidneys, and retina of the eye. A doctor will assess 4 signs of this damage, such as changes in mental status, heart attack symptoms, kidney dysfunction, or vision problems, to determine if your situation is an urgency or an emergency. Your ability to recognize these signs in yourself or others empowers you to take appropriate and timely action. Knowing whether you are facing a hypertensive urgency or an emergency is vital for protecting your long-term health. It empowers you to respond correctly, either by calmly contacting your doctor for an urgent appointment or by immediately calling for emergency medical help, ensuring you receive the precise care needed to safeguard your well-being.